So this, some of you might remember, we take a pause over the summer with these seminars. So this is the last seminar of this season, I guess you could say, this semester. And we'll start back up again in September. If you miss our monthly seminars, you can go watch some of our previous ones. We have a YouTube playlist where we share all of the recordings. And so if you'd like to, take a walk down memory lane, or maybe you missed some, I'm going to put that in the chat, that link to that playlist, so that everyone can take a look over the summer if you'd like. And then we'll start back up in September. In the meantime, we'll be planning the fall talks. And so if you have any particular topic areas of interest that you'd like us to have some speakers share their expertise on, please feel free to reach out to us. And I'm going to also put an email address in the chat where you can send any ideas or requests for topics. Yeah, we're excited to hear from our techs. So Dr. Nickelbein will introduce them.
Good evening, everybody. It's my sincere pleasure to introduce tonight's speakers, who are two of our veterinary technicians here at Cornell Equines Hospital. LVT Jalen Meyer and LVT Michaela Frost. And they'll be presenting on a veterinary technician's point of view, caring for your horse at Cornell's Equine Hospital. They both play really vital roles in the daily care of patients at the clinic, and are also in leadership positions, both in the hospital and in LVT organizations outside of the hospital. We'll go through just a quick bio on each, and then we'll turn it over to them. So Jalen has always had a strong interest in horses from a young age. He competed in local rodeos growing up and with his family. After high school, he attended Alfred State College's veterinary technology program, from which he graduated in 2012. He then completed internships, both with a large standardbred breeding farm and then with Peterson and Smith Equine Hospital in Ocala, Florida, with their ambulatory service. He then worked at Peterson and Smith for many years as a surgery technician before coming back to New York in 2015 and joining Cornell. And in 2016, he also started part-time with Finger Lakes Equine Practice. He's currently the section coordinator of the Large Animal Emergency and Patient Care Department, and has been highly involved with the American Association of Equine Veterinary Technicians since 2014. In what limited free time he has, he enjoys riding his horses and relaxing and spending time with his family and friends. And then Michaela has also had a passion for large animal veterinary medicine since she was a child. She volunteered at a local animal hospital and also grew up riding quarter horses at a local ranch. She attended the same school, so Alfred State College's veterinary technology program, and also competed on their polo team. She graduated in 2016 and then spent a short time in small animal general practice before joining Cornell and starting her career here at 2017. She, for 4 years, worked in the large animal emergency and nursing care department, and then transitioned to the large animal operating rooms in 2021. She's currently the student employee supervisor, the LVT preceptorship program chair, and then also the chair of a newer committee on the LVT internship program. So both very, very qualified and well-loved here at Cornell, and we're excited to hear from them this evening. I'll let you guys take it away.
Awesome. Thank you so much, Dr. Nickelbein, and we really appreciate you bringing us on tonight. So we're here to talk to you a little bit about veterinary technicians and what we do in the hospital, and a little bit of a background on the profession. So according to the AVMA, which is the American Veterinary Association, veterinary technicians are educated in the care and handling of animals, the basic principles of normal and abnormal life processes, and in many laboratory and clinical procedures. All veterinary technicians work under the supervisor of a licensed veterinarian. And while a veterinary technician can assist in performing a wide variety of tasks, we cannot diagnose, prescribe, perform surgery, or engage in any activity prohibited by a state's Veterinary Practice Act. So just to give you a little bit of history on the veterinary technician the profession has been around since the early 1900s. We've been helping veterinarians just without kind of a title. Around 1960 was when the U.S. Army, Purina, and the State University of New York started to establish animal technician programs. They really wanted to put together some educational programs and start providing more for the profession. In 1961, SUNY Delhi, which is local to us, actually started the very first veterinary technology program, which is pretty cool. In 1967, the AVMA began regulating these programs so that in 1972, we actually had the very first veterinary technician national exam. In 1989, the title veterinary technician was adopted, and it's grown since then. Currently, right now, there's around 230 programs in the United States. 21 of these programs actually offer 4-year degrees, which the 4-year degrees are typically geared towards practice management or potentially wanting to become a veterinarian. And 9 of these programs offer distance learning. So you might have heard of a program named Penn Foster. These are primarily online programs, but they do require a large amount of hours working in a hospital and taking lots of videos of you doing different tasks. Across the states, only 37 states have veterinary technician licensure. So it is not a nationwide licensure, which all of the organizations are currently working towards having all of the states gain licensure. So if you live in other states, you actually might hear something other than LVT. So here in New York, we are deemed LVTs, which are licensed veterinary technicians. Other places you might hear of an RVT, which is a registered veterinary technician, or a CVT, which is a certified veterinary technician. All of these terms are all a technician that has gone through an AVMA accredited program and who has sat for the VTNE. There is a difference with some other professions, but and right now a lot of the organizations are starting to adopt the term CRVT, which is a credentialed veterinary technician. So to kind of tell you the timeline to get where we are, we obviously have to graduate high school, and then we get admitted into an AVMA accredited institution. At a minimum, you need to have an associate's in veterinary technology, but as I said before, you can go for your bachelor's. The bachelor's, again, is either a little bit more of scientific classes or is also based around practice management. In school, our classes typically are going to be based around anatomy and physiology, medical terminology, animal restraint, radiology, pharmacology, microbiology, clinical pathology, nutrition, anesthesia, surgical nursing. Most of these classes do have hands-on labs. When you've graduated from your institution, you then have to sit for the veterinary technician national exam, which is a 170 multiple choice question exam that lasts around 3 hours. And then after that, you're not done. We do have to maintain our licensure. So we do have to complete a certain amount of continuing education during our career. In New York State, this varies state by state, but in New York State, we do have a requirement of completing 24 hours in 3 years of continuing education. This doesn't seem like that much until you have to complete it. An hour is an hour. This can be a mixture of online courses. It is a requirement to have so many in-person courses, wet labs, so on and so forth. And this is just to make sure that everybody stays up to date with all of the relevant information in our industry, because as we know, medicine changes constantly. And this can't just be, a talk given by anybody. In New York State, this does have to be RACE approved. RACE approved means that it's approved by the Registry of Approved Continuing Education. So it does go to a board, and then they decide whether it qualifies for credits towards our licensure. After that, some technicians do choose to go on to do a vet tech specialty. So a vet tech specialty in large animal would be a large animal internal medicine specialty, or equine veterinary nursing specialty. These specialties take about 3 to 5 years to complete. You have to complete so many hours working in a hospital, doing certain tasks. You have to complete so many case studies and also write some case reports and sit for another exam. So there are some people that do accomplish that as well, which is pretty cool. So as I was talking about RVTs, CVTs, LVTs, and so on, there are veterinary assistants as well, which you may have heard of. Veterinary assistants are assistants that have not gone through a college program or obtained a licensure. They are typically on-the-job trained. There are certain states that do have a 6 to 12-month certificate program just to help with some of the basics of learning for these. Most of their duties are going to include a lot of husbandry duties. So they assist with cleaning, restraining the animals for things like blood draws, feeding the animals, grooming the animals, exercising. They can administer oral medication, but all of the other kind of tasks are deemed towards the veterinary technicians. So licensed veterinary technicians, a lot of this is just a little bit of what we do, but just to give you kind of an idea, we do take radiographs for the DVMs to assess. We can administer and monitor anesthesia. We are allowed to administer injectable medications, IM and IV, so intramuscular and intravenously. We collect diagnostic samples. We conduct the lab tests, including fecal tests, complete blood counts, etc. We maintain professional medical records, phlebotomy and catheter placements. We can triage emergencies. We perform physical exams on our patients, and we prepare the animals' instruments and equipment for surgery. We do a lot of client education. And then right now I threw this in there because it's foaling season. So we actually do quite a bit of neonatal ICU care as well. So even though we are often compared to registered nurses in human medicine, as we handle similar responsibilities in the field of animal health care, ranging from patient care and medical procedures to laboratory and diagnostic work. And even though we are closely related, we do not use the title veterinary nurse. This is because 35 states do have a restriction and title protection on the title nurse to only be used in human medicine. So this is a map. All of the grade states are states that have title protection of nurse. So I just wanted to put that out there, even though our job is very closely similar to that, we do not use that term, and that's why. In other countries, though, countries such as Australia and the UK, they do call their veterinary technicians veterinary nurses. So here at Cornell, this is all under the umbrella of Cornell University, but under the Cornell University's umbrella, we have about 120 to 150 total licensed veterinary technicians. So over on the left, these are all of the hospitals that we have underneath Cornell's umbrella. So most of you probably know the small animal hospital and the large animal hospital, but we actually have many more. So we have the Cornell Animal Hospital, which is our small animal hospital, Equine and Nemo Farm Animal Hospital, which is our large animal hospital. We have an ambulatory service that goes out to the farms. We have a small animal community practice, which is more geared towards the students being more independent and responsible, kind of like a private practice. We have a wildlife hospital. We have a whole shelter medicine program. We also have Cornell Ruffian Equine Specialists, which is a private practice, equine practice on Long Island. And we also have Cornell University Veterinary Specialists in Connecticut, which is another specialized small animal practice under our umbrella. So here at the university in Ithaca, we have about 120 technicians total. More technicians are in small animal because they have more departments than we do. So they have emergency and critical care. They have an intensive care unit, an intermediate nursing care unit, radiology, neurology, cardiology, oncology, internal medicine, surgery, anesthesia, wildlife, and shelter med. All of these services have technicians dedicated for those services. In large animal, we have probably just over maybe 20-ish technicians total. And So ours is divided up. Emergency and nursing care is actually our ECC, ICU, and INC all combined. And then we also have internal medicine, dentistry, surgery. We have a large animal anesthesia team, a large animal radiology team, and large animal theriogenology team, so reproduction. So we do have specific technicians for each of these services in the large animal hospital.
Great. So on top of all these things that Jalen just talked about that we do throughout the hospital, we are also very involved in student education. So we're very involved with the veterinary students with their hands-on skills and education, especially during their 4th year, which is their clinical year in the hospital. But we're also seeing a lot of the students between their 1st and 3rd years as well. Specifically, we do hire student employees in the large animal hospital. So we're usually teaching them on their shifts in their through their 1st through 3rd years. And then we also are teaching our future LVTs as well. So not only the DVM students while they're here, but LVT students who are still in school have the opportunity to come to Cornell and learn from the technicians here as well. So we have the preceptorship program where they come and spend part of their summer with us, learning as much as they can. And then we have our brand new LVT internship program, which is actually a year-long rotating internship throughout the hospital. So for our large animal interns, they will rotate through all those services in large animal that Jalen just described. And the LVTs are the ones on those services teaching them all of their skills. So whether it's these LVTs still in school or the DVM students, we're often teaching them their fundamentals. And these are things like physical exams, fluid therapy, and then monitoring that. Placing IV catheters, passing nasogastric tubes, all the nursing care treatments, which could stem from just blood pressure, critical care monitoring, EKGs. We teach them how to scrub into surgery with gowning and gloving, and prepare the patient for surgery. And just to show you on the left here, we have one of our student employees. We're teaching her how to place a nasogastric tube on a colicky horse. That's Ella. And then on the right, that's me teaching a little lab to all of our student employees coming in their 1st year on how to gown and glove. So we thought it would be helpful to walk you through what we are involved in and what we do when your patient comes in the hospital. So I wanted to start with an equine lameness case, since that's something that you guys commonly bring into the hospital. So when you first come to the hospital for a case like this during the day, an LVT will likely be the one who meets you and takes a history from you. And they'll also perform the physical exam on your patient. So just taking a broad look at the horse when it comes in, heart rate, respiratory rate, temperature, etc. And then we're often going to be the ones who are jogging during your lameness exam. So some of you might have gotten the privilege of watching parts of your lameness exam, but sometimes these can be pretty long tasks throughout the day. So a lameness exam can be pretty brief and be less than an hour. And then sometimes it can be complicated and hard to assess and take several hours throughout the day. So lots of physical fitness for us. I just want to show you a brief video of what a typical jog looks like. And then sometimes this is what happens as well. So it just goes to show that we work with a wide range of horses, from off-the-track thoroughbreds, horses that have hardly been handled, to Congress champions. So this requires us to be really well trained in equine handling skills, and make sure that we know what we're doing so we can keep everybody safe. So as far as where to go after the lameness exam, hopefully we can do some therapies. We might need some more diagnostics, such as imaging, and all these tasks have the LVT involved. So if we need to prepare the joints for injections, whether that's blocking or giving a treatment, that's us. We often will prepare the PRP, which involves drawing the blood, making up the PRP, and then again, prepping the joints for the DVM to inject. And I think a lot of you have probably heard the term PRP, but just for a review, it is platelet-rich plasma, which is a regenerative therapy to treat tendon, ligament, and joint injuries. So it is something we use pretty commonly. On the left there, that's me performing a shockwave therapy, which is something that LVTs in the hospital can perform. This is a non-invasive modality that uses sound waves to stimulate healing in wounds, ligaments, tendons, and also bony structures. It increases blood flow, growth of new vessels, production of natural healing factors. And we use this often for things like suspensory ligament injury, tendon disease, navicular syndrome, or simply just neck or back pain. So this horse here on the left was actually suffering from osteoarthritis of the thoracic and lumbosacral facets. So hopefully benefited from that shockwave therapy. On the right, we have some LVTs taking some radiographs of a horse. So our LVTs here in the hospital will put in requests for any imaging, and then they will also help in performing these tasks, which can range from radiographs to CT or also operating the MRI. And then I just wanted to go into surgery. So we're also a big part of the anesthesia and surgery team. So a common procedure that your horse might go into is an arthroscopy, especially following a lameness exam. So to start off, the LVT will place an IV catheter prior to surgery and administer perioperative antibiotics and analgesics before walking them up to induction. And that's Margie there on the left, just walked our friend up to induction. And once we get to induction, we're all hands on deck, where we have a room full of LVTs ready to induce the horse. We have Margie is put on a halter with a head rope. Lizzie is on the tail rope. Corey is on the shoulder and will transition to the head as well after she administers the anesthetic agents. And then myself is on the side of the horse to help guide them down while they're induced. Once they're induced in the induction room, the surgical technician is also responsible for getting them positioned on the table, which is not an easy task and can take a little bit of finesse. And then we also prep them for surgery, which involves clipping and scrubbing them and getting them ready to move into the operating room. So while the surgical tech is trying to do the positioning and surgical prep, things like that, the anesthetist, this is Corey, our technician in the large animal hospital, has in advance created an anesthetic plan. She's done all of her drug calculations and drawn up her drugs that are appropriate. And once we've induced the horse, she works on intubating, which you can see on the left. And then she also will start hooking up her monitoring equipment and getting her art line placed, which is what you see her placing on the right there. So once all of her equipment's hooked up, I've clipped and prepped the horse. We're ready to move in the OR. The technicians kind of have two roles in the OR. So there's always a circulating LVT who's helping the surgeons get scrubbed in to surgery, tying them in their gowns. We open the surgical room, so open all the sterile stuff on the table, and then we assist them with anything they need. So if they need us to open things, if it's a colic, which Jalen will talk about in a little bit, and there's lots of things involved, we become more hands-on during the circulation. We also sometimes scrub in. So the scrub LVT is mostly responsible for scrubbing in, setting up the table, making sure this table of instruments stays nice and organized, and we can hand the surgeons whatever instrument they need. We can often assist them with whatever they need during the surgery as well, which could be as simple as clamping a blood vessel, blotting, and then we often do the surgical closure on the skin. And then while that is happening, anesthesia is continuing to monitor our patient. So things like monitoring blood pressure, the EKG, capnograph, overall the depth of anesthesia, and they communicate with the surgeons and or intervene if there is any problems. On the right, you see Rachel is in recovery with a full. So the technicians are also responsible for helping recover the patient. For the horses, this could look very different depending on the case. We have inside the box recovery for things that are a little more critical or more prone to having a problem in recovery. So stuff like that would be like a fracture repair. Head and tail rope recovery, where we have a head and tail rope tied to the patient and can help assist them in standing, and then free recovery, which is a little bit more common for more routine cases. But often, especially when they're in the box recovery, we have anesthetists, LVTs who are watching the patients while they recover to make sure that they don't need to intervene in any way and that they are okay through recovery. And then themselves, or often the surgery techs, are inside the box during those inside the box recoveries as well, assisting the DVMs, which can actually be a fairly dangerous situation. But we are well trained in how to keep ourselves and others safe during those recoveries. And just briefly for postoperative care, the LVTs are also very involved in this. So even if your patient is going home that same day, we often need to do a bandage change, which might involve you coming in and just doing some client education and showing you how to complete that bandage change or wound care or whatever it might be at home. And also administering any medications postoperatively that the horse needs as well.
Yeah, so it really shows that it takes a whole team of technicians to get that horse from the beginning to the end. I want to talk a little bit about the dreaded C word and kind of how technicians are involved with an out-of-hours emergency. So I just wanted to start with, unlike the small animal hospital and some human hospitals, our large animal hospital is not staffed 24/7 with veterinarians. We do have veterinarians on call at all times to come into the hospital. We have one medicine and one surgery resident that come in to help with emergencies or any critical patients. But there are 2 to 3 licensed veterinary technicians that are staffed at all times in the hospital. So as an owner, you might find your horse colicking in the stall or out in the field. You've done what you can to help them along, but you've decided that it's a little worse than you expected. So you call your referring veterinarian to come out and do an exam. The veterinarian comes out, they decide this horse has a very massive colon impaction and it's more than what they can treat on the farm. So they highly recommend referral for more advanced care and more continuous care. So the owner or the veterinarian can call the emergency line and they'll talk to the resident doctor that's on call. Once they've gotten all the information, they will then alert myself, the LVT that's in the hospital, and I will begin preparing for the emergency. You as the owner will start to travel to the hospital. And this is why it's very important to call when you're 30 minutes out, because our DVMs are not in the hospital all the time. So at that point, the resident, when you get the call for 30 minutes out, the resident will head into the hospital to receive the colic. It does happen occasionally that an emergency may show up unannounced, or an emergency may show up sooner than expected before the veterinarian gets there. And at that time, the LVTs can triage the emergency and start our initial stabilization and talk to the veterinarian over the phone about what they would like us to do. So when your horse comes in for colic, we'll initially admit them and get the history. So we'll make sure all of your information is correct, go over a little bit of paperwork. We'll obtain a history. So you'll be met at the front doors by a couple LVTs and a student and a veterinarian. We'll ask kind of what's been going on. Has there been any medications that have been given? What's their normal feeding schedule? Has there been anything changed in their lifestyle recently to kind of gain some more information? And then we'll bring the horse into the workup room, and typically the owner will hang out in our waiting room. And then we begin the initial stabilization of the colic. So when I teach a colic workup to my students, I usually teach it kind of in 5 stages, and about 3 of those stages an LVT does. So stage 1 is going to be drawing blood and running our point of care blood work. So the colic will get a CBC, which is a complete blood count, basic chemistry, blood gas. We'll check their hydration status. As you can see Shelby doing up in this first picture. And then next, we'll place an IV catheter to make sure that we have IV access. This is how we can start with our fluid therapy right away. We also want IV access in case the horse is really painful and we need to sedate them more than once. So the LVT will then place a catheter, suture it in place, and start fluids on the patient. And that's usually about stage 2. Stage 3 is going to be if the horse is painful or if we have concern that they need a nasogastric tube placed, the LVT will place a nasogastric tube. As we all know, horses cannot vomit, so we need to help them relieve their stomach if it's very distended. So down in the bottom left, this is Jen, one of our technicians, teaching one of our students how to pass a nasogastric tube. And then on the right is myself and another technician the other night with a little foal, passing a nasogastric tube on the little foal that came in. So this is kind of the initial stabilization that the technicians do. During this time, the veterinarian will be performing a physical exam, and then they start their ultrasound and they'll perform their rectal exam, which are only done by the veterinarians. Technicians can ultrasound, and actually the out-of-hours technicians are trained in flash ultrasound, which is a fast localized abdominal sonography of horses. This is just to get quick views of different parts of the abdomen to send to the veterinarians to then assess the patient. But during the initial work of the veterinarian, we'll do that. We restrain and make sure that the veterinarian is safe during those procedures. And then typically the last procedure is going to be an abdominocentesis, which is collecting abdominal fluid, and then we will run lab work on that. This all happens very quickly. And then once we've kind of figured out what's going on with the patient, the veterinarian will come and talk to the client and say, you know, this horse has a large colon impaction. It's going to need to be started on IV fluids, oral fluids, and it'll need to stay in the hospital for a couple of days. Once the owner agrees, then the licensed vet tech will come up. We reiterate that, and we'll actually go over a consent form, which is here on the left, saying that you have consented for Dr. Sfraga of the emergency service for hospitalization and medical management of your horse with colic, meaning IV fluids, oral fluids, ultrasound, sedation, and so on. If the horse goes to surgery, this is also a consent form for surgery to consent to anesthesia, and we will go over all the risks that are involved with anesthesia. During that time, we do collect the deposit, which can always be a tough conversation, but we do need a deposit, and then we'll send you over to our small animal hospital to have that get paid. After that, we'll put the horse in the stall, get them comfy. These pictures here are a little bit more advanced nursing care. This isn't going to be if you're kind of running the mill colic, but it just kind of shows all of the things that we have to hook up to a horse sometimes. So the horse on the left, that horse was actually a severe, very severe colon impaction. That horse was on multiple CRIs of fluids. He actually had a CRI of fluids going into his nasogastric tube, so getting fluids directly to his stomach at a continuous rate. He had intravenous fluids, and he also had rectal fluids. So he had fluids going into his rectum to try to help break up this colon. Part of that is this horse is so big, it can sometimes be really hard to hydrate them enough to be able to help break down the impaction. But as you can see, that is quite a lot of lines that are connected to that horse. So we need to make sure that they are all labeled correctly and he doesn't get tangled up in them and rip anything out. On the right, we have a technician that's very proud of her setup on a very critical horse. This horse came in for a colitis and actually was getting a blood transfusion along with plasma transfusion and IV fluids. The horse is also hooked up to oxygen. So this kind of shows like the immediate nursing care for some of these patients. And then during their stay here, they do get treatments every 2 hours. So at a minimum, every 2 hours, we're looking at these patients, we're writing in their medical record, we're monitoring their fluid therapy to make sure that it's running correctly, making sure they're not getting too many fluids or not enough fluids. Our horse, most fluid pumps only go to about 1 liter, maybe 2 liters of fluids at a time. Some of these horses require much more than that. So a lot of our fluids are run by gravity flow. So we have to be very careful that the horse is getting enough fluids and not getting too much. And then we'll be doing serial blood work on them. We'll do physical exams every 6 hours or even sometimes more. things like cryotherapy with managing ice on their feet. And we have a direct line to the DVM at all times. So if we have any concerns or if there's any abnormal changes on the physical, we contact the veterinarian and then they can make any changes that need to happen. So we're very involved with these patients all night. As you can see here, I just threw in a couple pictures of different technicians doing a couple different things. Up in the left-hand corner, that's actually my mare who came in on emergency for a prepubic tendon tear, and she foaled out in the hospital. That is Jess getting her all nice and pretty. She was due to foal in the next couple of days, so she was braiding her tail so we could get it taped up. On the top right is Corey. That was a horse with a bad joint infection. He really loved bananas. So that was after Corey gave him his medications in a banana. Bottom left is actually Michaela here. She was monitoring a horse that wasn't supposed to be colicky, but did end up being colicky while in hospital. So sometimes we do sit, if we have time, at the stalls to make sure that we're really monitoring the patients closely to see what kind of minimal changes that they have. On the right bottom corner, we actually have Pat, who's another one of our LVTs that you might see in the front office now as he manages our front office. He's helping a newborn foal nurse for the first time. And then, so we see your patient all the way through to the end. So again, we monitor them every day, every 2 hours at a minimum, taking care of them. We have different types of enrichment that we provide for the patients. You know, we take them for walks, we take them outside, we create little toys for them in their stalls to make sure that they have a decent experience when they're here. And then we follow them all the way through to discharge. So here is Jess, one of our technicians who's discharging a horse. During the discharge, you'll be met by the technician who will go over all of the medications that your patient's going to go home on. Why they're going home on those medications, and if there's any concerns about those medications. You might not be able to see it, but here on the screen, this horse was, or a horse was going home. This isn't for this horse. A horse was going home on chloramphenicol, and we have it bolded that the owner needs to wear gloves when handling this medication because it can cause a rare disease. So we're very strict about telling clients to be careful about certain medications. We go over the routes, the times, so on and so forth. We also go over their feeding instructions. A lot of these patients go home on pretty strict feeding instructions, not to be just given free choice food again. So we'll go over the different types of food, why they're getting them, and then how often they're getting them. And it can sometimes provide some insight on if you would like to try something different with your horse. And we'll also go over the kind of exercise plans for when they go home, management in the stall, and etc. So we'll follow it all the way through from the beginning to the end. And I think, oh gosh, that was a lot faster than we expected. So sorry. We really tried to slow it down. At this point, I think if there's some questions or we can elaborate on anything that we do, we're happy to do that.
That was wonderful. Thank you guys so much for the overview of what you do. And certainly your talk was, expansive, but I think there's a lot that you guys do behind the scenes that doesn't get recognized routinely and, is critical to the function of the hospital. So just want to thank you for taking the time to present tonight. We don't have any pending questions in the Q&A, but we can hang out for a little while in case any further questions pop up. We will be back with our next installment in the fall, likely starting in September, but we'll send out an email announcement about the dates for the fall 2024 talks. And it looks like we now do have some questions coming in. Question from Callie, are LVTs in as short supply as vets? That's a very, very relevant question. I'll let Jalen and Michaela tackle that one if they're able.
Yes, LBTs are in a very short supply right now. It's actually very hard uh, to find somebody to hire. There's not a lot of technicians coming out of these programs. And especially for large animal, there's a very, very small amount of technicians coming into large animal. And obviously, as you can see, we need a lot of them. We are working with local schools, local colleges to try to promote large animal medicine and show them that there's a lot of careers that they can take. As you saw, they can work in radiology, they can work in anesthesia, they can, and these are all, this is kind of what they do all day is they do anesthesia all day, they do radiology all day. You know, if you work out of hours, you kind of do a little bit of a mix of all of it. But I think that we are at just as much of a crisis as the veterinarians are at this moment. And I do want to say, you know, this is a very rewarding yet challenging career. It does require both technical skills and a deep love for science and math, and you know, communication and a love for animals. But yeah, unfortunately, there's not a lot coming out of school right now.
Yeah, there are things that we do try to do routinely and meet a lot of what can we do, you know, to promote this profession and have more people going into these programs and graduating and hopefully coming to places like Cornell. And a lot of those things that we hope to help with in the future are things like the LBT preceptorship program that I talked about earlier, and also this new internship program that's really hopefully creating kind of a pipeline for LBTs into this profession. So if we can help them in high school a little bit, which we do through other programs, help them through their degree of veterinary technology, and then get them into an internship afterwards so that they're really set up to really go anywhere in their career. So hopefully things like that will help this in the future. And not only that, but like our current LVTs that are in the profession, it's really rewarding for them to be able to be a part of programs like this and teaching instead of just doing the emergency and patient care and day to day, which is very, very important. But sometimes some LVTs are looking for a little bit more, and stuff like that in a teaching hospital is a great way to go about it.
Excellent. Thank you guys for that thorough answer. We also have a thank you in the Q&A. So Shannon said, just wanted to say thank you so much. I had no idea the extent of work you guys all do. And that certainly gets to the point of us, you know, inviting you guys on is, you know, wanted to showcase all that the techs do there and the assistants as well, vital to the function of the hospital, and to the care of the horses that come in. So thank you guys.
Yeah, well, thank you, Shannon. It's really nice that we do get this opportunity to be able to kind of say some of the things we do, because we do find quite often that clients don't know what veterinary technicians are and what we're capable of doing. And especially in large animal medicine, we're really taking strides and not kind of just being hitching posts as what a lot of technicians have been in the past and kind of just holding horses. You know, here at Cornell, we have some pretty advanced skills. We have multiple in-house labs throughout the year and lectures. As I said, you know, we don't have veterinarians staffed at night unless they absolutely need to be here. So we're trained in a lot of different emergency procedures. You know, we're the eyes and ears of the veterinarian when they're not here. So we're trained well enough and hopefully they trust us enough, and because they aren't here babysitting us constantly. So yeah, it's a pretty cool career.
I posted the link to NAVTA in the chat. Do you guys have any other resources or any info on for those people interested in maybe pursuing a degree in veterinary technology or becoming a vet assistant? Any other resources you'd recommend for them to look into, or specifically if they're interested in kind of training at Cornell, following, you know, their or during their LVT program, how would they go about doing that?
Yeah, so I think that's a great place to start. The link to NAVTA just gives you a lot of more background on what the career is. Of course, I am very involved in recruitment and development of LVTs from high school on. So if you have any questions about becoming an LVT, places you can go, I'm always happy to answer any questions. I think if you're very excited about equine, the AAEVT is a great resource as well. That is typically for already licensed veterinary technicians and assistants, but it has a lot of great information on that website as well. And Jalen is very involved with that program.
Yeah, and the American Association of Equine Veterinary Technicians, even though it's termed technicians, it's actually for all staff that is involved with equine medicine. So technicians, assistants, even office staff. So anybody that wants to kind of advance their career in equine medicine. It's another great website to check out. They do have an online certificate academy, which is kind of like the veterinary assistant certificate program, where there's multiple videos and learning objectives for people to learn. And the AAVT also just came out with new guidelines for veterinary technicians and kind of different levels of things that we can perform, tasks that we can perform and do. So it's also on the website.
Excellent. And I just posted the link to the website there in the chat. A question, can you live out of state and do an internship at Cornell? I don't know if you can answer that one, Michaela.
So currently, I guess I would say, like you could get accepted in the program, but you would have to basically move near Ithaca to be on site. It is an on-site internship. Not to say that that's not a great idea for the future. But yes, if you live out of state, which we have had a couple applicants, as long as you are license eligible in New York State, and pass your exam, you can still apply and get accepted in the internship program, but you would have to move to the area.
Do you have to have a New York State license, or can you just be eligible?
You can just be eligible. We will help you get your license if needed, but we need you to be eligible. You can get accepted without actually having passed your exam yet. But your employment during the internship would be dependent on you passing your exam within the first couple months of your internship.
Excellent. Thanks for clarifying that. Audrey posted just a little bit of appreciation here. She said she had a horse have very extensive surgery, and it was clear how kind and caring everyone was to her mare. She lives pretty far away from Cornell, and so her mare was here for a while, needed a second surgery, but Cornell saved her life. So thank you, Audrey, for sharing that experience. And then we will try and get an updated link to that study on colic survival. I'll see if I can find that now and put it in. Any other questions that we have? Looks like that's about it. Thank you again, Jalen and Michaela. We really appreciate your time.
Yeah,
Absolutely.
so
Thank
much.
you.